have such a high incidence of prostate cancer compared to other groups?
Well, that is one of the questions we're constantly battling with throughout the entire urologic community. We don't know. We have some, thoughts, some theoretical hypotheses, if you will, that we can, sort of place. We think diet is the only thing that all the studies have shown that kind of pans out that maybe what blacks, African Americans are more prevalent to have prostate cancer. We also have found out that there is hereditary cancer. And I'll explain that for you, Dr. Haney. If you have an uncle or brother or father with a history of prostate cancer, your chances of developing cancer within yourself is about 30% higher than someone that does not. So at least we have in the grasp that there is a form of hereditary cancer, but to say what causes blacks to have African Americans to be a high incidence of prostate cancer than their counterpart, Caucasians, we don't know the answer for that.
But you would suspect that diet plays a significant role in it. Now, how would diet play such a significant role in
there are studies that point towards the fat content in one's diet tend to have you increase, I guess, not awareness, but increased incidence of cancer of all types. Stimulants, caffeine, coffee, as I said, fat, and I think your genetic background all predispose you to the higher risk of cancer.
And so if you are involved in any of those as risk factors, then the possibilities of you contracting this disease is greater. Is that what we're saying?
I think it's fair to say that if you have the risk factors, smoking, stimulants, not exercising, not eating properly, high fat content, you are probably more disposed to having cancer than someone that does not participate in those things.
Well, now, how does an individual determine, I guess what we're looking for are some of the warning signs against cancer and prostate cancer, and are there any warning signs? What do you generally consider to be warning signs?
Well, of course, that is one of the main things that we have to grasp with prostate cancer. Prostate cancer can be, it doesn't have really any true warning signs except that you may see a change in your stream, you may see blood in your urine, or you may have pain. But unlike some other cancers, normal organs, I mean, this enlargement of the male's prostate over time will give you the same symptoms. So you have a coronary there, prostate cancer, prostatitis, which is inflammation or infection of the prostate, and then normal growth, enlargement of the prostate, can all give you the same symptoms. And that's why we have allocated through, over the last 5 or 10 years, the screening for prostate cancer, which we offer every year throughout the nation, where we advise males, Caucasian males, at age 50 to have a rectal exam, and African-American males, especially if you have a family history of prostate cancer, to have a rectal exam at age 40. And we also now have a blood test that we do, and most people are familiar with that, and we call it PSA, that we also perform at the time when we do a rectal exam.
And so there are tests that you use in order to determine whether or not a person has been infected by this disease. But now, the problem is trying to get folks to come in to take the test. With it.
That is correct, Dr. Haney. I myself has taken a personal crusade to make the African-American population more aware of prostate cancer. I think that is one of the things that we, as a race or ethnic group, need to really put our concerted efforts to, is that we present or participate in all the things that is made available to us. I mean, to come into the health arena, to at least have a screening examination, and to be aware. And education, I think, as we are trying to do in this program today, is one of the ways that we need to reach out to our African-American brothers and tell them that they at least need to get a screening exam and at least a rectal exam once a year.
Very good. Let me stop for this first commercial break, Doctor, and we'll be back with you following this short commercial break.